Hi guys, welcome to Medicine Made Easy. In this lecture, we will go through the subject proper of approach to a patient with fever. In the last video, we discussed about the basics of fever, and in this video, we will go through the topic proper, that is approach to a patient with fever. If you didn't watch the first part, please go through the link in the description given below. Basically, microorganisms enter the body through the skin and the mucous membrane. Infections are the most common cause for fever. And among the infections, viral infections are far more common when compared to bacterial and fungal infections. Other causes like non-infectious causes to be considered autoimmune, autoinflammatory, and vasculitis. Malignancy, miscellaneous causes like drug reactions, and undiagnosed causes. Among the most common causes of fever in India, infections contribute about 50%, neoplasms 20%, connective tissue disorders 9%, miscellaneous causes 15%, and the remaining 6% are undiagnosed. A fever of duration less than 2 weeks is mostly infectious, and if the duration of the fever is more than 3 weeks, consider the non infectious causes of the fever also. Usually, a rise in the temperature is associated with a rise in the heart rate, that is 2.44 beats per minute per 1 degree rise in temperature. A condition called temperature pulse dissociation, in which there is relative bradycardia, is seen in case of typhoid fever, leptospirosis, rickettsiosis, dengue fever, legionellosis, and babesiosis. Epidemiology of any infectious disease depends upon the pathogen, the susceptible host, and the environmental factors. Most infections are transmitted horizontally between people by contact, like hands for mites, or a common vehicle, as in case of food, water, or air, as seen in case of tuberculosis, or vectors like mosquitoes. Evaluation should determine whether the condition might be due to a transmissible agent and its source, or whether the patient has done recent traveling, whether there are any other secondary causes for the fever. Patient's age influences which illness one should consider while examining a fever case. Natural exposure or immunization limits certain illnesses such as rubella, and varicella. Other physical effects of aging, such as impaired bladder emptying, leads to increased rates of urinary tract infection in the elderly. In most instances, a febrile illness is accompanied by localizing symptoms and signs which suggest a specific diagnosis. History taking is very important, and in history taking, one should search for the symptoms suggestive of localization. Symptoms of the respiratory tract. A upper respiratory tract infection is suggested by rhinorrhea, nasal stuffiness, sneezing, sore throat, cough, and a hoarse voice. Sinusitis presents as facial pain and headache. Otitis is associated with ear pain, ear discharge with or without deafness, while a lower respiratory tract infection presents with cough, productive sputum, shortness of breath, wheeze, or chest pain. Hemoptysis suggests invasion of the blood vessels and damage of the blood vessel. This is seen in case of TB, fungal infections, non-infectious causes like lung cancer and vasculitis. Coming to the genitourinary tract. A lower urinary tract infection classically presents as combination of dysuria, frequency, urgency, and a change in smell and color of the urine. A upper respiratory tract infection present with the above symptoms along with loin pain and back pain. Sexually transmitted infections and pelvic inflammatory disorders can present with the similar symptoms as a lower or upper respiratory tract infection, but have additional symptoms of vaginal and urethral discharge, dyspareunia, anogenital ulcers, genital warts, painful swelling of the scrotum, pubic itch, or a swelling of the lymph glands in the groin. Vaginal candidiasis in women, particularly seen in case of women who use vaginal douches or after a course of antibiotics. It usually presents as urinary tract infection along with whitish vaginal discharge and vaginal itching. Bacterial vaginosis is not considered as a true infection, but rather it is because of an imbalance of normal vaginal flora and overgrowth of anaerobes. It presents with watery, foul smelling vaginal discharge. Gastrointestinal system. Abdominal pain is the most common presentation in any gastrointestinal causes for infection. Gastroenteritis, the most common gastrointestinal infection, is associated with abdominal pain, diarrhea, with or without vomiting. Hepatitis is usually caused by viral agents and can also occur as a complication of medication. Jaundice is also a sign in case of hepatitis. Cholecystitis and cholangitis, classically present with pain in the upper quadrant of the abdomen, associated with nausea with or without jaundice. Other causes of intra-abdominal infections include bowel perforation, peritonitis, and it presents with varying abdominal symptoms, including generalized or localized abdominal pain, bowel distension, diarrhea, constipation, and vomiting. Next comes the central nervous system. Symptoms of the central nervous system include headache, photophobia, vomitings, altered consciousness, fits, fainting, muscle weakness, numbness, paralysis, tremors, abnormal sensation, and change in the behavior. These symptoms can suggest any infection of a central nervous system. Meningitis. Meningitis is an inflammation of the subarachnoid space and meninges, and most commonly occurs secondary to an infection. It presents as headache, vomiting, neck stiffness, and fever. Depending on the duration of onset, it is classified as acute, subacute, and chronic. Encephalitis. Encephalitis is the inflammation of the brain tissue resulting in an altered level of consciousness, headache, and fever. Additional symptoms include seizures, tremors, stroke, hallucinations, and abnormal behaviors. Intracranial abscess. Intracranial abscess are bacterial infections of the central nervous system and include brain abscess, subdural or extradural emphyema, and they are classified according to their anatomical location. Next comes the skin and the soft tissues. The presence of a rash is more likely to suggest a systemic rather than a localized condition. Remember to ask about any insect bite or tick bite. Rashes following a bite could indicate a vector-borne disease. It is important to distinguish a generalized rash from a localized skin or soft tissue infection. The localized infection is more likely to be asymmetric or unilateral and involve the tissues deeper than the skin. Some examples of localized infections are impetigo, which is a contagious infection caused by staphylococci or occasionally streptococci. Cellulitis. Cellulitis is a bacterial rash of skin involving the deeper structures, most commonly affecting the leg. Next, necrotizing fasciitis is a severe and rapidly spreading form of cellulitis. It is a medical emergency and requires antibiotics and sometimes debridement. Musculoskeletal system. Bone, joint, and muscle pain form a part of the constitutional symptoms of infectious and non infectious diseases. Joint pain can occur in both native and prosthetic joints. In a patient complaining of arthralgia, one should distinguish between monoarthralgia and polyarthralgia. Monoarthralgia is likely to be septic, while polyarthralgia suggests a more systemic disease. Bone infection can occur in any bone in the body, either as a primary infection or secondary to underlying skin or soft tissue infection. Bone pain, swelling, deformities, pus draining through the skin overlying the bone suggest possibility. Next comes the cardiovascular system. Infectious endocarditis. Infectious endocarditis is an infection of the endocardium or lining of the heart. Symptoms are non-specific and diagnosis should be considered in patients with damaged or prosthetic heart valves or those with risk factors for recurrent bacteremias like pure dentition, intravenous drug use, long-term use of intravascular device, or underlying bowel cancer. Myocarditis. Myocarditis is an inflammation of the muscle of the heart and usually caused by viral infection. Symptoms are non-specific and include shortness of breath, chest pain, and palpitation. Vascular infection can occur as a primary vascular infection of the endothelium or secondary to damage caused by the catheters, cannulas, trauma, or surgery. This completes the symptomatology of the various systems. When a patient has fever and only non-specific constitutional symptoms, it is very difficult to address the problem in a single ambulatory clinic visit. So it requires a balance between observation and investigation. This completes the today's topic of discussion. Next week we will discuss about approach to a patient with PU. Thanks for the patient listening. Please like, share and subscribe.